Diabetes, also known as diabetes mellitus, is a condition that affects insulin. And for those who don't know insulin is a hormone that breaks down sugars in your food and then converts them into glucose to fuel up the body. What is diabetes? Diabetes occurs when your body does not process food as energy properly. So insulin is a critical hormone that gets glucose to the cells in your body. So here when we talk about glucose, I mean the sugar that is used as energy. So when you have diabetes, your body either doesn't respond to insulin or doesn't produce insulin at all. So this causes the sugars to build up in your blood, which puts your body at risk of dangerous complications. Types of diabetes. So diabetes can be classified as type 1, type 2, or gestation. Let's first talk about type 1 diabetes. So type 1 diabetes is an autoimmune disease in which the immune system attacks and destroys the cells in the body that produce insulin. So the rate of type 1 diabetes is rising worldwide, with the greatest increase occurring in children younger than age 5. So in people with type 1 diabetes, the body does not make enough of the hormone insulin, which enables the body to convert glucose into energy. Type 1 diabetes develops when the insulin-producing beta cells in the pancreas are destroyed due to an autoimmune process in which the body's immune system mistakenly destroys its own organs. So the onset of symptoms can happen quickly, whereby people who have diabetes type 1 may need daily insulin shots. Now let's talk about type 2 diabetes. So type 2 diabetes is a metabolic disorder that results from the body's inability to make enough insulin or to properly use the insulin. So type 2 diabetes is the most common type of diabetes whereby the pancreas produces enough insulin but the body cannot use it effectively. So this is referred to as insulin resistance. Now let's talk about gestational diabetes. So gestational diabetes develops during pregnancy when a hormone made by the placenta prevents the mother's body from using insulin effectively. So gestational diabetes is not caused by lack of insulin but by other hormones produced during pregnancy that can make insulin less effective. So gestational diabetes symptoms disappear after delivery of the baby. So today let's talk about pre-diabetes. So in pre-diabetes, the blood sugar level is elevated but not to a degree that constitutes diabetes. So people who have repeated tests showing elevated fasting glucose have increased rate of developing full-blown diabetes. So people who are over 45 years should be tested for pre-diabetes or diabetes. So in most cases, if the first blood glucose test is normal, individuals should be tested every 3 years. So if you're under the age of 45 years, you should consider a test of pre-diabetes or diabetes. In most cases, if your body mass index is greater than or equal to 25. You have several risk factors such as sedimentary lifestyle, taking certain medications,